I'm from Zimbabwe. I've had a back problem for a number of years. I then was able to walk on my own in 2009, 2010, and 2011, and 2012. But I was having problems or pain in my back. After doing all the necessary paperwork, the payment of the operation, the visa application, buying a ticket, I then came to Nova. So Dr. Raheja, after having seen the my hips, came to me before I had the MRI done and said, as far as was concerned, the likelihood is the problem that I'm having. And by the way, the only pain that I was having was on my left leg in the main. I had slight pain on my back, but the main pain was from the left leg. And he says, as far as he had seen the X-ray that was done, the problem may be coming from a hip that was collapsing on my left leg. I had the operation done on the hip. I stayed in hospital for 6 days. I was then taken to a hotel where I was then observed from by Dr. Raheja and the physiotherapist that taught me how to walk. I then did the exercises that they told me to do, and now I can do 5-10 steps with a limp, however, but without the aid of a walker. I was well looked after. I had my 3 meals a day. I had the sisters, you could call them anytime and they would come and attend to you.
Mr. Mishek is a 65-year-old gentleman. He belongs to Zimbabwe. He was operated twice there for lumbar canal stenosis and radiculopathy, but his symptoms were not relieved. His last surgery was done in 2014. Then he communicated with us through an insurance company, and we reviewed the reports and called him here. And on investigations, we found that actually his symptoms are not because of the spine, right? He was suffering from severe osteoarthritis of left hip joint, which the doctors in Zimbabwe, they failed to diagnose. And it took him by surprise because he came here for redoing the spine surgery, and he was taken aback, but we thoroughly counseled him, and luckily he agreed for that. And then we did a uncemented total hip replacement, and his pain went away. Next day he was walking with a walker 2 days after the surgery, and now he is independently able to ambulate, and he is undergoing physiotherapy, and he is very happy with the procedure.